Hi, my name is Katie Lindmark, and together with Kimberly Smith, we have put together a video PowerPoint presentation to help educate people on hepatitis B. In this presentation, we will be discussing things such as what is hepatitis B? Where does it come from? How can we get it and who's at risk for it? And things such as what are the signs and symptoms of hepatitis B? And is there treatment for it? And can it be prevented? All right, well, let's get started. So what is hepatitis B? Very simply put, hepatitis B is a virus that when left untreated can cause major damage to your liver. This damage can include liver disease, inflammation of the liver, scarring of the liver, also known as cirrhosis, liver cancer, and even liver failure. Most people don't know, but hepatitis B is one of 5 different types of hepatitis, the others being hepatitis A, C, D, and E. So what is the etiology of hepatitis B? I think first we should know what etiology means. Etiology is what causes a disease. Hepatitis B virus, which is also known as HBV, is a member of the HepDNA virus group. It is a double-stranded DNA virus, which replicates semi-unusual. It is done so by reverse transcription. Hepatitis B, or HBV, is the prototype member of the family HepDNA-viridae, a group of small enveloped DNA viruses found in mammals. And if you look at the picture in the bottom right corner, it gives you a better visual of what this would look like. So there are 2 types of hepatitis B, acute and chronic. Acute meaning short term, typically less than 6 months, and chronic meaning long term, greater than 6 months, and sometimes a lifetime in length. Acute HBV is a short-term illness which usually only lasts a few weeks but can last up to 6 months. Most commonly, the human body is able to fight off acute hepatitis B on its own without any long-term or lasting side effects. However, chronic HBV is a long-lasting infection with the virus in the bloodstream for greater than 6 months. It occurs when the body is unable to get rid of the HBV virus. Unfortunately, it usually has no real symptoms until the liver damage has already begun to occur. Fortunately, for most healthy adults, around 90% who are infected with the hepatitis B virus will recover and actually will develop a protective antibody against future HBV infections. Alright, next let's discuss hepatitis B, its reservoir and prevalence. First, we should know what a reservoir is. A reservoir is anything, a person, animal, plant, or substance, in which an infectious agent can live normally and multiply. So for hepatitis B, its only known natural reservoir is human, meaning it is not known to be found in any plants, animals, or other substances. HPV is an infection that is the 10th leading cause of death worldwide, causing about 1 million deaths a year due to its chronic form of the disease. This statistic did kind of surprise me, as there is vaccinations you can get to prevent hepatitis, which we will discuss later in this presentation. But if you look at the map below, it shows you the pink areas are the highest prevalence for hepatitis B worldwide. And it shows that areas such as northern South America, surprisingly parts of Alaska and northern Canada, and the majority of Africa are all at highest risk for hepatitis B. Most all of Europe and Asia have an intermediate to high risk as well. However, places like North America, Australia, Mexico, and Argentina all have a relatively low risk for hepatitis B. So now that we know what hepatitis B is and where it can be found, Let's discuss the signs and symptoms of hepatitis B. First, what is the difference between a sign and a symptom? A sign is typically objective, while a symptom is subjective. This means doctors, family, and third-party members can see signs, but symptoms, on the other hand, cannot be seen. They are solely patient-reported. So what are the signs of hepatitis B? Most commonly, they would be dark urine, fever, and jaundice. Jaundice being the yellowing of the skin and whites of the eyes. As far as symptoms go, many people have no symptoms at all during the initial infection. However, there are some who develop a rapid onset of sickness, including but are not limited to the symptoms listed below, which are abdominal pain, loss of appetite, nausea and vomiting, weakness and fatigue, and joint pain.
Okay, so I'm going to be talking about how hepatitis B can be transmitted from one person to another, also how it can be treated and prevented. So we'll go ahead and start with transmission. There are a few ways that hepatitis B can be spread from one person to another. One way is through sexual contact. So if a person has unprotected sex with someone who is infected with hepatitis B, they themselves can also be infected from blood, saliva, semen, or vaginal secretions that enter into their body. Another way is through sharing needles. So if obviously if there's someone who is infected with hepatitis B and they are using a needle for drugs or anything, they can, if they share that needle with someone else, if there is blood that is infected with that hepatitis B, they can spread that to those other people who use that needle. And a third way that hepatitis B can be spread is from a mother to her child. So if a mother is pregnant and she is infected with hepatitis B, she can actually spread that to her child. Fortunately, now in most cases, babies can receive a vaccine that can help prevent that from happening. So there are a few different types of treatment just depending on the situation. If you are exposed to hepatitis B, but you're able to get to the doctor within around 12 hours of exposure, usually they'll give you a vaccination and a shot of hepatitis B immune globulin. This will just boost your immune system and it'll kind of fight off the infection so that you might not actually develop the infection. So that would be the best case scenario. Another situation might be if you are diagnosed with acute hepatitis B. This is just short-lived, so it may actually go away on its own. If this is the case, then the doctor will just tell you to get plenty of rest, make sure you are taking care of your body, so make sure you're just keeping a healthy diet and drinking lots of fluids. Also just really taking care of your liver, so stay away from any alcohol and just make sure you check with your physician before taking any over-the-counter drugs or any supplements or anything that could potentially be harmful. Another situation is if you're diagnosed with chronic hepatitis B. This is long-lived, and with this situation you actually need to continuously take medication, so you can just prevent liver disease and also prevent the prevent the infection from passing to other people. So treatments for chronic hepatitis B, there are a few for this one. These include antiviral medications, which are listed here. Um, they help fight off the virus and just kind of slow the ability to damage your liver, or for the infection to damage your liver. Also, there's interferon alpha 2b, which this also helps fight the infection, and this one is actually used more in younger people with they don't want to undergo long-term treatment, and they maybe want to have kids in the next few years. They'll usually choose this option. If your liver has been severely damaged, the best option would be, if possible, getting a liver transplant. So hepatitis B can be prevented. Um, there are a few important things to remember just to prevent being infected from hepatitis B. The best way to prevent it is by getting vaccinated. So um, the vaccination is just given, it's 3 or 4 injections just over a 6-month period. A lot of times in high schools they'll do that for students. Also, something really important to prevent being infected with hepatitis B is just knowing the HPV status of any sexual partner. Also, if your partner is infected or if you have multiple partners, it is very important to use condoms every time you have sex. Also, don't use illicit drugs, and if you are using them, just try to get help to stop. Be cautious about any body piercings and tattoos. Just make sure needles are sterilized and cleaned and everything, and so that doesn't cause any infection. Also, just make sure to wear gloves when touching or cleaning up any body secretions of others on personal items. So who should get vaccinated? Pretty much everyone. Just it's important for newborns to be vaccinated. Also, children and adolescents who have not been vaccinated, who weren't vaccinated at birth. Anyone with a sexually transmitted disease, which includes HIV, healthcare workers, emergency workers, and any other workers who will come in contact with blood or any other body fluids. Developmentally disabled people who are living in an institutional setting, men who have sex with other men, people with multiple sexual partners, anyone with chronic liver disease, anyone who injects illicit drugs, people with end-stage kidney disease, and sexual partners of those with hepatitis B, and also travelers planning to go anywhere with a high hepatitis B infection rate. So that is basically it for hepatitis B.